welcome to attend, and other providers throughout the state are also welcome to attend. The meeting recording and slides will be sent to everyone and will also be publicly posted in perpetuity as this is a grant-funded activity. So if you don't belong in Wearable Duress Solutions, this is your time to exit the plane, but hopefully you meant to be here. So you have the option today for dial-in or computer audio. Your computer audio can be impacted by your internet connection. And also keep in mind that sometimes having your video on can make your internet unstable. So if you experience that, just turn off your video. Not that we don't want to see your face, but that helps sometimes. Do ask questions today. We ask you to use the chat box. Put your question in addressed to everyone. If you put a direct message in there, it will likely be missed as the speakers are busy speaking. And those messages to direct folks are not saved after the program, whereas if you put it in the chat box for everyone, those questions are saved. So if we miss anything, we can always go back and answer them later. Laura is with me. She's going to be monitoring the chat box, helping me there. We'll do Q&A at the end. But please don't wait till the end to think of your question. Just type it in as you think of it. If you have a slide number you want to reference, you can even slap that in there too. Keep microphones muted through the duration of the program. As you are all probably familiar with the background noises that can be very distracting. We don't want to have to boot anybody off, but if we get a lot of background noise from someone who does not mute, we will boot you off and you'll have to come back in, and we don't want you to miss anything. I'll repeat again, slides and program recording will be distributed and publicly available. We do have a YouTube channel for emergency management, so all of the programs that we have done in the past few years are posted there. You can share those with your patients, your staff, anybody can access those on YouTube. Our grant disclaimer and acknowledgments to our partners. This project was funded by the Department of HHS, Administration for Strategic Preparedness and Response. We call them ASPR, and made possible by a grant from the New York City Department of Health and Mental Hygiene, Office of Emergency Preparedness and Response. We give special thanks to Fidel Monroe, who is on today, but a little bit behind the scenes. There she is. She's going to give us a wave. She's the Senior Program Manager for Long-Term Care, Bureau of Healthcare and Community Readiness at the Office of Emergency Preparedness and Response at New York City DOHMH. And she is instrumental in helping us develop all these programs and making sure we cross every T, dot every I, and bring you what you need. So we welcomed you. We are going over the agenda. We're going to just do some quick introductions. We have just me and one speaker today, so that'll be quick. I'll give you a little bit of a program overview, and then I will bring up my featured subject matter expert today, who will give you everything and more that you ever wanted to know about duress button applications and devices. We will hold Q&A for the end. We'll make sure, Paul, that we leave 10, 15 minutes for that at the end, 10, 12 minutes. And I can watch it to help you watch the time. And then we'll talk about what we need you to do for the evaluation of the program and talk about some future events. So for those that don't know me, I am Carole Deyoe. I'm a registered pharmacist, but my main job is the Director of Regulatory Affairs and Special Programs for the New York State Association of Healthcare Providers. We represent the home care sector, mostly licensed agencies with advocacy, education, and support. And it is through grants, through our foundation, that we are able to bring you this emergency management programming. I'm joined today by my colleague and dear friend and boss, Laura Eric, who is going to monitor the chat for us. She's our Vice President of Public Policy, and I really appreciate her taking time out of her day to help out. And then Dina Collins, behind the scenes, our IT guru person, is making sure that we run smoothly with our tech today. So thanks to both of them for helping me out. So why are we here? What are we going to talk about? Back in 2021 and 2022, HCP joined our colleagues at HCA and did a New York City Home Care Emergency Management Needs Assessment to figure out where is home care in the emergency management ladder of things. What do you need? What do you lack? What are you great at? And every single thing that we did and all the evaluations going forward for all of our programs identified communications as an area of concern for providers. So this year was one of our deliverables. We're producing 2 educational webinars to address gaps that you might have in communication capacity for your home care agency. Donna, do you want to turn your video off? I love that you're exercising, but it might be a little bit distracting for folks, and I will do it with you during a break. Don't be embarrassed at all. That's wonderful. It's what we
I'm
all ought to
very
be doing.
sorry. Just a little
Don't be
stiff.
sorry. We all need
Sorry.
to be doing that while we're sitting in front of our screens. So I appreciate it. I
Yeah.
wanted to let you go, believe me. Um, so this first webinar, as I said, is going to talk about the duress applications. And the next webinar, which is scheduled for April 15th, I'll talk about later, is going to be effective messaging, which is going to be a lot of fun. So today we'll talk about the benefits of wearable duress buttons for home care workers in the field, different applications. These devices or applications allow the user to covertly, so in secret, summon help if they're faced with a dangerous or a potentially dangerous situation. And our workers, as you know, 95% of your staff is in the field every day, right? They need a way to call for help. And that's why we're here to help you figure out how you can help them to do that. Oops, I went ahead a little bit. So now I am thrilled to introduce someone who's become a friend, Paul Sarnese, who is the owner of Secured and Prepared Consulting, LLC. He's a certified healthcare protection administrator, a certified crime prevention through environmental design specialist, and the past president for the International Association for Healthcare Security and Safety. In 2025, Paul was recognized as a top 40 global thought leader by the Life Safety Alliance. In 2024, Paul was recognized as a security industry innovator for his approach and process for conducting healthcare workplace violence program assessments. In 2022, he was recognized as the Campus Safety Healthcare Security Director of the Year and was a finalist in the ASIS Outstanding Security Performance Award. He has had leadership positions directing and managing safety, security, emergency management, and operations in large health systems. Paul has a bachelor's degree in criminal justice from Rowan University, a master's degree in safety engineering from Warren University, and a master's in administrative science from Fairleigh Dickinson University. I went there too. In 2020, Paul was presented with the Russell L. Colling Literary Award for making a significant contribution to the healthcare security, safety, and/or risk management professions. He has published over 40 articles and has been a keynote speaker nationally and internationally. He's often featured on national and international news media discussing current events involving workplace violence and healthcare safety and security. From Secured Prepared Consulting, please welcome Paul Sarnese. Thank you, Paul, for being with us.
Well, thank you, Carol, and thank you everybody for joining the webinar today and taking time out of your busy schedules. I know this is a topic that is very important for all of us, and our staff safety is paramount in everything we do. And I'll share with you some stories. I've always been blessed to work for very large healthcare organizations on the East Coast, and every one of them had home care organizations as part of it. But we also had things like dental, pediatric mobile dental, and outreach programs. So always working with colleagues that are in the community, and certainly there's an inherent risk in working in our communities, different than it is in working in the four walls of a hospital. I mean, we know in healthcare, healthcare employees are 4 or 5 times more likely to be the victim of aggravated assault. Those same risks that apply in a healthcare acute care setting do also apply to those of us that work in home care as well, because of, it's kind of a microcosm of society, right? We're dealing with people under stress and anxiety, and sometimes in high crime areas. So we need to keep our staff safe and secure at all times. So really for today, the agenda is going to move relatively quickly because I want to reserve some time for some Q&A. But we're going to talk about, what is a panic button or a duress button. You'll hear those words interchanged quite often. Typically, a panic button, think of a Staples Easy button. It's something that's very kind of overt. It's easy to access, something that would maybe be on a desk, and you can just kind of hit that button. That's more of a panic button. A duress button is something that's a little bit more discreet, something that you would typically see maybe mounted underneath a cashier's desk, or somebody in a retail space, or on a badge or on your body. But please just understand that those words will be interchanged. Both duress and panic are pretty much very similar. We'll talk about the pros and cons as you're evaluating and as you're considering deploying these very essential devices. We're going to talk about some of the current solutions that are on the market today. And I really reserve the solutions I'm going to share with you today for those that are specialized for home care. There are a tremendous number of technology solutions that are really for the four walls of a hospital or the four walls of a long-term care facility, but there are very few that really are specific and have a proven track record for working in the community and being successful and providing what they state that they're going to provide to the end user. And we're also going to talk about some things to consider as you're implementing and looking for funding for these tools. So what is a wearable duress? Well, it's basically, it could be a button, it could be a badge, it could be a badge reel, like you see that folks that maybe have a time and attendance system, they have a badge that has a string that can pull out. It could be a iPhone, it could be a watch, it could be a fob that is attached to your phone. It could be a fob or a button that is attached to your ID badge. There are a lot of different options that are available on the market today. And obviously, they're designed to be discreet. And there are some that are better than others out there, and we'll talk about them throughout the presentation. But it's really important that our staff has the ability to discreetly activate an alarm and not bring attention that they're, to the person that's in front of them that they're actually calling for help. The other key features to really look at as you're evaluating these products is it a one-touch activation? Do I have to hit the button 2 or 3 times? Are there multiple buttons on a single badge that I need to hit? And there's no right answer, but there's some things that really differentiate the products from each other. Some products have two-way communication. I think that's something that's really important. God forbid one of our coworkers pushes the button on whatever mechanism is provided. And they have no idea that the alarm or the alert has been received on the other end. I couldn't imagine what that would feel like to continue to push a button not knowing it was received. So some of them have haptic response, so you'll get a buzz. It will vibrate to let you know that the alarm was received. Others have a feature where you'll actually get a two-way message, a display literally on the badge that says alarm is received and help is en route. So a lot of different options for you to look at as you're evaluating deploying this solution for your colleagues. Some of the key features, real-time alerts. I always suggest if you have a current mass notification system, so if you have a system that you can push out text messages or phone messages or desktop alerts, and you have that type of infrastructure currently in your portfolio, reach out to that vendor because most of the vendors that have gotten into this space have kind of piggybacked off of things like asset tracking systems or patient tracking systems or mass notification systems. So if you have a mass notification system, the first thing I would recommend, so you don't have to reinvest in any infrastructure or maybe other technologies, is to see if that vendor has this solution available to them. But the real goal is to provide that real-time alert when I need help, if it's police, if it's EMS, if it's my manager, if it's security, whoever is the first responders, I want to have that immediate notification to them. We also want to make sure that our locations are turned on at all times. I think one of the things that I always stress to my clients when they're evaluating these systems is we have to make sure that we're talking to our employees and letting them know that Big Brother is not watching at all times. We are not always going to be tracking the location of our employees. But when they push that button and they need help, we need to know where they're at so that we can provide that information to first responders, or the system and the solution can automatically provide that GPS location to first responders. There are some organizations I work with that are tracking their employees at all times. They want to know where they're at. I mean, they're tracking their vehicles for speed and for location, and they're tracking their employees at all times through this GPS technology. But we really just want to emphasize when the staff pushes the button, it's going to be an immediate alert. And when the staff pushes the button, their real-time location through GPS will be provided to first responders. Many of the systems integrate with time and attendance and billing systems. So I have a client that is a New Jersey client that actually uses their system to, when the home care employee pulls up to the address, that the bill starts, and it starts to track the time and attendance or the time that that employee is providing services within their house, and it's actually feeding the EMR and it's feeding the billing system. So you have a lot of different integrations that are potentially available to you, and we'll talk a little bit more about them as we go further. All of the systems have the ability to customize the alerts. So if you have a security team that supports you and you want security to be notified first, they could be notified. If you want a manager to be notified at all times when a button is activated, the manager could be notified. If you want to bypass security and bypass a manager and have the alert go directly to police dispatch through the software of the solution provider, that could happen. There's also other customizable alerts, and you'll see when we get into some of the examples of the badges, you could have a medical alert versus a workplace violence or staff duress feature on that badge. As mentioned earlier, there's within the four walls of a facility, we're typically relying on the IT infrastructure. So we're relying on the distributed antenna systems. We're relying on the intranet or protocols and the organization's kind of IT infrastructure. Outside in the community, we don't have that benefit. So it's either going to be cellular connection or satellite connection. And we'll talk a little bit more about that because I would imagine many of you, like me, live in very rural areas. I live in New Jersey, so yes, we have very populated urban environments, just like New York State, but we have a lot of rural areas. And I'll tell you a true story that happened to one of our home care providers that really made us reevaluate the solution that we deployed. So some pros and cons to think about, and I really think that the pros certainly outweigh the cons here. So the pros: faster help. It's a discreet way for staff to call for assistance. Now, I'm sure many of you train your staff to have a script in their head if they're in an uncomfortable situation. Maybe they see a weapon on the table, or they see narcotics on the table, or they're just uncomfortable because the family member of the patient is intoxicated and acting a little inappropriate. Is to have something already scripted in their head. Oh, I forgot my blue folder. I got to go out to my car and get the blue folder. That gives them an excuse to leave, right? And it's a discreet way of doing it. Well, that's what these buttons are designed for, to discreetly be able to call for help. The location tracking, again, you have the option of keeping that on at all times or only when the button is pushed. And the systems that you want to evaluate, you also want to make sure that they're not only dropping a pin at that location when the button's pushed, but they're leaving breadcrumbs for when that badge is moving. Okay, so that it's constantly being tracked, because we know one incident or an incident could move, right? So we want to make sure that that has the ability to do that. But obviously, these systems support lone worker safety. They help us comply with potentially comply with laws and compliance with other regulations that most likely will be passed in the future. But they give staff confidence that I can go to a patient's home, provide outstanding care, and know that, God forbid, I need help. I push one button, and within 10 seconds, that alert's received, and first responders are being dispatched to my location. And the other thing, it sends such a fantastic message to your coworkers that the organization cares about them and that you care about their safety, and their safety is paramount. Some cons, certainly it's the cost. I mean, there's a cost to doing business, and there's a cost to keeping our employees safe and secure. And that is a challenge for some organizations. For most healthcare organizations, cost is a concern. So, we have to make sure that we do the return on investment. We do that analysis, and we demonstrate the immediate impact to staff's perception of safety, and we can measure retention and recruitment through deploying this type of technology. There are some limitations, though, that we all need to be aware of. So if you're providing services in a high-rise building, there's multi-stories. The GPS location in some systems may only provide that address. It may not say the first floor, the second floor, the third floor, and so forth. So when you're evaluating these systems, that is really, really important information to have that conversation with the solution provider. Some operational risk, and these are inherent with most technologies that are deployed. The device loss, battery failures, poor staff adoption, I think, is number one. So I work with many, many organizations that have deployed this technology for their staff, mostly within the four walls in healthcare. And so I know organizations have spent hundreds of thousands of dollars to implement this. And I'll be at the ED nurses station, and I'll look at the ED doc and say, Doc, I understand your organization deployed these wearable solutions. Why aren't you wearing it? And the doctor will say, I don't want Big Brother watching me. I don't want Big Brother to know what I'm doing every moment of the day. Well, that was poor adoption. That was poor training and poor education. So it's real important that whatever solution you choose is that your employees have skin in the game. They're part of that decision-making process, part of the evaluation process, and they understand what the system can do, and just as importantly, if not more importantly, what the system cannot do. And I'll tell you some stories about what I experienced in a very in a union environment here in New Jersey with my home care agency. Some things to consider. I mentioned this earlier, but some of the badges, they can have multiple buttons. So you can have one for a medical emergency versus one for a workplace violence incident. Many of them will have the ability to go directly to the PSAP or right to the police dispatch. So that immediately eliminates 3 or 4 seconds in time going through a software solution who's monitoring and then sending the notification. This may or may not be appropriate, but sometimes in facilities, we want that emergency button to also lock our doors. So just think if you're in a home care agency and someone within your facility, the 4 walls of your offices, or a touchdown location where your staff picks up paperwork and maybe medical supplies for wound care. If they push the button, maybe you want to lock that front door. That's all available through the technology today. Geofencing is something that we implemented in the organization I worked for here in New Jersey. We have some pretty high crime areas in the state, and we wanted our staff to know that when they were hitting the borders of these high crime areas, we wanted them to get an alert. So as I'm driving and if I hit the border of a high crime area, we would have an alert come right to their mobile device at the time that would say, you're entering a high crime area. Here is the number for the local police department. This is the address for the local police department. We worked it out with many of those local departments that when our staff was going into those areas, they were able to call them, maybe not always get an escort, but at least the law enforcement agency was aware that our home care staff was in a high-rise building or in a residence in those high crime areas. Some of these systems also, when you push the button, it starts an incident report. So we'll start tracking the date, the time, the initiator of the alarm, when the alarm was received, so that you can track in real time what's actually happening at that situation. Weather alerts and traffic alerts are also things that could be pushed through the technology. So just imagine, there's a tornado warning. Well, the same system that you're using for your mobile duress could also push a message to your mobile phone that says the National Weather Service has just issued a tornado warning for the immediate area. Seek shelter. So again, you have some things that you can really get one solution for, but it will actually take care of multiple issues. So I'm going to start getting into some of the products that are available. And again, I chose these products because they're the ones that have the most market share in the home care space. Okay, many of them also support hospitals and the four-wall organizations, but these are really the ones that are more prolific in the home care space. The first one is strategics, and
I,
many of you.
Paul, I'm sorry to interrupt you. I just want to chime in and remind folks these are not endorsements or
Good.
advertisements for any specific product.
Thank you.
These are just like Paul said, big market share,
Yeah.
well-known names that you may have heard of. Just want to get that disclaimer out there. Thanks.
Yeah,
Sorry.
and no, Carol, thank you for saying that. And certainly, I have no skin in the game here. So I'm an
Yeah.
independent consultant. I am totally vendor agnostic, solution agnostic. But when you look at the market share, these are the ones that are out there. And certainly, there are
Thank
many
you.
others. And that's why I said there are many solution providers out there. These are just some of them. So strategics, again, they started within the four walls of the hospital, but they migrated out to providing the services to home care agencies. Again, they have a single button application. It does provide real time, or I'm sorry, GPS location, like all of them. They too provide. I mentioned this earlier. It's either going to be satellite or cell. So Strategics is on cell. So you have to make sure you have a really good cell signal where you're at. We'll talk about some new technology that allows you to have both cell and satellite as we go forward. Um, but these systems again kind of migrated from the healthcare, I'm sorry, the four walls of hospital into home care. So what they have come up with is this multiple buttons that provide the same type of response, right? So, they talk about having multimode location accuracy with their GPS. Two-way communication is really important in some instances. So this device here that you're looking at to the right, you can tell it's a speaker. So there is the ability to talk back and forth and say, "Are you okay? Do you need help?" That may or but something that again is up to you in the technology. This is what you're seeing everybody doing right now, and it's not providing one solution. It's providing, or I'm sorry, not providing one device, but multiple devices because everybody's so different. So you have a wearable device. You also have a badge that you could wear and that you would actually push where it says crisis alert wearable badge, you push that button right in the middle. One button. Okay. Um, and many of these are programmed where you can, if this is desirable, to say one button is going to notify my manager, two pushes is going to notify first responders. You have that um, configurability. You can also have it on your phone. I don't know of anybody that doesn't have their phone, within reach right now. So you have the ability to not only have it on your a badge or maybe something you're wearing a pendant on your lapel, but you also have the ability to use it through your phone. And again, very similar the way the systems are designed, but you can pick and choose who you notify, and you can pick and choose if it's one button, or one push, two pushes, three pushes, and so forth. Those notifications could go out by text, by phone, by desktop alert, however you want them to go. And I think that's really why I think this presentation is so important for you, just to get that foundational information, what's available, because you really can't go out and start evaluating products unless you really kind of think about what do you want. Um, this is what they call their command center. This may or may not be appropriate or even desirable for some of you, but you have the ability at all times to see what's happening. You do have the ability at all times to, if you decide to monitor GPS location all the time, is to see where your staff is. So that may be important for you operationally. That may be important for you to say, okay, who's the closest home care provider that can respond to this call right now? My wife's a hospice nurse. So, they try to geographically locate or dispatch her where she's geographically located. So this may be something that not only provide staff safety, in an emergency situation, but also be able to help you operationally. It's how you want to use the system. So here's the if you're looking for contact information for anybody from Strategics, feel free to reach out. Okay. So this is a unique system. This is called Quema. This is a one of a kind system. The panic button is actually in the badge reel itself. So it's not anything else that you have to wear. It's literally in the badge reel. Um, Same thing. It's either through smartphone or Bluetooth or beacon. It could, again, this started in the four walls of the hospital and migrated out. It uses GPS and satellite signals to receive that alert and then send that signal to the either the manager, the desktop alert, or the local police department or first responders. It's again how you want to configure this, but this is very unique because it's actually in the badge reel itself, which I thought was unique. And I actually had one of my clients deploy this solution because they felt that they didn't have to provide any additional items for the staff to wear. It was something that was not going to change, excuse me, not going to change the staff's routine and not have to wear two or three different badges or two to three different devices. So again, just wanted to, I included this so you can see what's available in the market today. Again, real-time location is part of the system like all of this. Um, One of the big differentiators when you're looking at these systems is data that's available. So if you want to know who pushed a button and when somebody responded, that's going to be with every one of them. But just say you want to know, um, how many times was this button pushed by that staff member? All of them are a little bit different as to what data you can pull out of the system. So again, think about if data is important to you, what data you want to get before you sit down and start talking to some of these providers. So this is another product that's out there on the market. It's called 911 Cellular. This one was actually not designed specifically for the four walls of a hospital, but was really designed for lone workers. And really, what's different about this system is they actually have a feature on this where just say I'm in an uncomfortable situation and I need to step away, but I don't have the ability to say to the person I'm in front of, I need to step away and get this call. So on one of their devices, it's called a step away feature. I thought this was really cool. And it's right on their mobile app. And if I hit this button called step away, within 30 seconds, my phone's going to ring. That's going to give me the excuse to step away and answer that call. So it's a very discreet way of kind of getting out of a very uncomfortable situation. Again, these are very configurable. Is it one button push? Do I push it twice? They also have the ability to have it on a smartwatch and a badge and the cell phone and everything like that. But this system, out of all of them, this is the one that's been around the longest and was specifically designed for the home care worker. Aristaflow is another one that they have been around for quite some time, and they again have that two-way messaging that both the haptic. So when I push the button, I will get the alert. My badge will buzz, so I know that somebody received it. But they also have the ability to send text messages. So you just got to think about how operationally this is going to work, though. So if I push a button on my badge, I get the buzz that the alarm was received, but I also may be able to read a text literally right on the badge that says 911 received alert, police have been dispatched. So that may be something that is attractive to some of you. Beckler is another company that's been around for probably 30, 40 years. They do a lot of work with individuals that climb cell phone towers, and they do a lot of things for lone workers. So if this is important to you, things like, do you want to know, God forbid, if your employee was in a car accident? Their system can tell you. Do you want to know if the employee fell down? Their system can tell you. If the employee hasn't moved for a while, and kind of like this man down, I know it kind of sounds sexist, but a man down feature, this system can tell you. And they also have, all the different types of devices. It could be a smartwatch, it could be a pendant, it could be your cell phone, it could be anything that's going to initiate that alert. And again, GPS tracking for all of them is always when the button is pushed. Some of them have the ability to monitor the locations after the button's pushed, so leaving those breadcrumbs as the individual continues to move. So things that you consider as you're evaluating these products. When it comes to IT, I'm going to skip that slide. When it comes to the infrastructure that's required to support these systems, it's either going to be cellular or satellite. So again, I mentioned I live in New Jersey. We have a lot of pine barrens and farmlands and so forth around here. So one of our home care workers um, was doing an admission. She went to a farm. The farm. She was given the description of the house on the farm, the blue house on the farm. We had no idea there were four blue houses on the farm. And as she's walking up to knock on the door, she falls through the porch. The porch literally collapses, and she's 3 feet into the porch on this property. And we did have a solution. It was a mobile solution that was part of our mass notification system, and she activated the alert. We never got the alert. And thank God, family members realized that she was expected, saw her car on the property, and were able to come and find her. I mean, you're talking about almost a worst case scenario. Thank God it worked out the way she did. She was still down there for, I want to say 15 minutes. Could only imagine. So that told us we had a significant issue in the Pine Barrens with cell phone. Cell phones were not working. So we had to switch at that time, at least to the staff that was being deployed to that county that we served. They had to have sat phones. Now this was back in 2010 when sat phones were a little bit more expensive than they are today. But if you don't have good cell connection, a satellite phone is the way to go. The beauty of today's technology is that you can buy a smartphone today that will be on cell tower signal. And when it loses cell phone signal, it can go right to satellite. Okay. So again, one of the things I would always suggest, if you're considering deploying this technology, is meet with your cell phone provider, have them provide you with a heat map showing you your geographical area where you support, where you can actually say, I have good signal here, I have bad signal here. They may want to work with you and boost the signal in some areas, but if they can't, at least you know that you may have the option to go satellite, or for a certain number of folks to say, okay, we're going to provide you with a phone that goes from cell to sat, or we're going to provide you with a sat phone that's dedicated to the team that provides services in that area. So really something to consider when you're looking at this. There's been a lot of research out there about the benefits of wearable devices. Most of that is geared towards the hospital. We all know that there's pending legislation in the state of New York that may require social services agencies and retailers to provide panic buttons. I know on the retail side that was passed. That's moving forward. That will be a 2027 requirement. I'm hoping and maybe somebody here that has an update for us at the end, but that we see more states pass this requirement. I mean, unfortunately, many of you, I'm sure, know what happened in Connecticut. There was a home care employee that was dispatched to a known offender's house, and she was assaulted and killed. And in response to that, the state passed legislation that's requiring home care agencies to provide their staff with wearable devices because the technology works. So it's just some things for you to think about. As you're moving forward with implementation, sit after today, think about all the different things that are available to you and what you want. What is a must have? What would be nice to have? Okay. And then reach out to some of the vendors and start talking about some of the solutions they provide. I would always suggest you do a little trial. And what we did at our organization, I think I mentioned to you, I had three different unions to deal with. So I actually worked with the union leadership to educate them on what was available. I had them pick the solution. I had them talk to their members about the great solution they picked. And then we basically said, okay, let's try a demo for 6 months. It was the union shop stewards that had the pendants, so they were able to push them and get the confidence that they worked. We went from a 6 month trial to a 1 month trial, and then we went with a full implementation. Uh, but really having that union leadership involvement in the selection, in the evaluation and the selection was paramount. So I would always try a small little pilot, get that confidence, and really get to test the system. And then have cadences. Like what we did is we were a very large health system. So we had meetings scheduled with the vendor every week. And even if we pushed a button twice to test it in a week, we still sat down and talked about it. Was it the right GPS location? Did it go to the right person? Did it provide what you said the system was going to provide? So we constantly had that feedback. And certainly for most of us, if we're gonna spend dollars and we're gonna invest in any technology or systems, we want to be able to demonstrate that return on investment. We want to be able to demonstrate some key performance indicators. So I always suggest if you're going to deploy this, do a survey with your staff before deployment. How do you feel? Basically, it's a staff, um, it's a perception of safety, and measure it. And then after you deploy it, measure it again. And I guarantee you're going to see a difference and an improvement in your staff's perception of safety. When it comes to grant funding opportunities, I know this is really Carole and the team's expertise, not mine, but there are some opportunities out there. I made a joke at a school board meeting not too long ago about a GoFundMe project for a private school that was looking to fund security technology because they really had no funds. They did a GoFundMe campaign and they received $10,000 for improvements in their security systems. It was a very rewarding experience to hear that feedback, but I kind of said it tongue in cheek, but
Yeah.
it worked. So please just know that there are some funding opportunities for you out there, and certainly because many of these providers, solution providers that I shared, and many others that I did not share that are out there, are looking for agencies that they could say, "Hey, we're working with this home care agency in the state of New York." They're given incredible incentives for first adopters so that you benefit because instead of paying $20 a month or $25 a month per badge, you're paying $10 a month. But they're also able to market that to others to say, hey, we're working with this large healthcare organization in the state of New York. So don't be afraid
Cool.
to have those conversations with the solution providers as to if there's any opportunities to be early adopters and to kind of take advantage of some of those cost savings initiatives.
Yeah, one of my mottos, Paul, is if you don't ask, the answer is going to be no. So you might as well ask, right?
Absolutely, absolutely. So that Carole, that's pretty much the presentation. I just wanted to pop this up. This is some of my contact information, but at this time, I would love to entertain questions from the audience.
Yeah. And if we could switch the share,
Yep,
that will
all
be
yours.
great. I'm hoping I get the right one. So help me out, Laura, if I get the wrong one. Can you see um
Yes.
Yep,
my
you are,
slide?
you're good.
I'm on the welcome. So everybody close your eyes so you don't get dizzy. Um, and Paul, I will mention to our folks that I think there was more information in the slides you gave me than you even showed today. So the slides that they're going to get in the PDF have even more information than what you provided. So I
I
did
would agree.
notice a couple of questions, and I want to add a couple of comments to those questions. So the first thing is someone asked about EVV integration, and Paul, I feel like I really dropped the ball because you and I didn't talk about this. Electronic visit verification is something that home care agencies are
Yeah,
required to do by federal law. So, I think I would say that a lot of these EVV providers, your software vendors, would be able to do this as an add-on so that it's one and done, as far as the GPS location and all that. So,
absolutely.
somebody asked, can you add EVV to this? And I think it would be the opposite. You would add this to the EVV because that's a little bit more of a complex system.
Yeah, I would agree with you. And that's typically how we've seen that kind of evolve over time is
Yep.
that um, because staff duress really, think about it. I mean, staff duress, it was available 5, 6 years ago, but it didn't have the attention that it's getting today.
Yeah. Yep.
So the EVV systems were kind of preempted that. So
Yep.
there are all these solutions and many others typically provide an API or an interface that you could connect with that EVV. So again, I know I mentioned earlier, but I show up to the address. Well, now the clock is ticking. Now it's going to
Yep.
start
Exactly.
billing for those hours and the services I'm providing. And,
Yeah.
home care agencies do it, outpatient physical therapy does it. There's a lot of different um, hospice, many organizations do that. So if that's important, I would first have that conversation with your EVV because the infrastructure is existing.
Yeah, yeah. Great point. And then the other thing I wanted to mention is that I know you mentioned it, is the integration with any mass notification system that you're already
Yes,
using. And I
yes,
just want to direct anybody on here if you didn't see it in the chat. We do have a presentation on that very topic. We did it, I think, 2 years ago. And we had actual home care providers that use different systems on, to talk about the different pros and cons, what features to look for and stuff like that. So you can look for that hour-long webinar on our YouTube channel. And
yeah,
then these
yeah,
two
yeah,
can absolutely tie together.
yeah.
So
And
now
Carol,
I'm
one
going to
thing,
get to the, oh,
yeah.
go ahead. Go
No, I was
ahead.
just going to say one thing I wanted to add is a lot of the mass notification systems have started to add features like virtual escort features,
Yeah,
so that I basically say, okay, it's going to take me 20 minutes to get from point A to point B, and I set that clock or that timer on my device, so that if I don't get there in 20 minutes, or if I'm not leaving in 20 minutes, however it's programmed, that I'm going to get a countdown that I could either stop the countdown because I got there safely, or if that countdown is not stopped by me and I don't get there in 20 minutes, it's going to send the alert to my supervisor or 911 or whoever it
nice.
may be. So that's kind of how I saw over the years those mass notification systems start to get into this space.
Yeah, yeah. And now that I want to address the questions that were in the chat. Besides that, one which I thought was a great question: do these systems have to be registered with local authorities so that and the first responders are aware? How does that work?
Yeah, great question. So you don't have to be registered, but it's certainly a conversation you want to have with your local police department or your Office of Emergency Management to let them know that you're deploying this because one, they want to be. We should obviously have that great relationship with our local law enforcement,
Yes.
but you want to make sure that they're aware of what's going on and how you're deploying it. Especially if you're going to utilize the geofencing feature, that's going to send your staff alerts when you're going into some of these high crime areas, because there may be more of a demand on the local law enforcement. So yes, it's always a great advice or process to let them know what you're considering deploying, and maybe even have them, give you some input. They may have some other experience as to, what worked in a local school district or what worked in another organization.
Great. And then on that same note with local authorities, what about false alarms? I mean, those are going to be inevitable.
Yeah,
Are there any ramifications for the agency or the actual employee to sending a false alarm? Do they get a citation,
great question. It's a great
with
question. So
yeah, those are great questions, aren't they?
yeah,
Yeah.
so I've been in the business for about 40 years, and it's pretty common practice for local law enforcement to fine organizations for false alarms, for burglar alarms, so for a residence, for a property. So if you have three alarms in a quarter or three alarms in whatever time period, and they're all because of somebody did not know the code, the local police department may issue a citation. Okay. And you can find that's publicly available to you, that information. I don't know of anybody in my time um, that was ever fined for pushing a panic button or a duress button because we never want to put that barrier or that fear into somebody and say, okay, don't push it. We want to say if you're thinking about pushing it, push it. And we don't want to have any barriers or any um, any kind of negative connotation about pushing it. So I don't know of anybody that has ever been fined for an activation of a duress or a panic button.
That's great to hear. And you've been in this business for a couple minutes, so I know you you
You can
have the
say that again.
experience. That's for sure. Um, I wanted to mention how cool that step away feature is and how it might be helpful in a dating situation as well, but that's for another day. Um,
Well, Carol, that's why I included that. I thought that was one of the coolest things I've
it
seen come
is
out in the last 2 years.
that's really
And
cool. Yeah.
yeah, I think you'll see more and
Yep.
more organizations or more and more solution providers adopt that feature as well.
Yeah. And I also want to remind folks of something that you mentioned a couple of times is the leadership buy-in, which is so important for any program that you have, especially in emergency management. It's a culture, right? It's a culture of safety. So really nurturing that is super important. And then when we're thinking about cost, I was on a webinar recently in emergency management, and I wrote it down, and I even put a little sticky on my computer screen so that I don't forget it. Every dollar that you invest in emergency preparedness gives you a $4 to $6 return in savings. That's huge. Now, I'm not saying that that's for this item or for any particular action that you take, but in the aggregate, every dollar invested is going to get you at least $4 back. So,
Well, Carol, I couldn't agree with you more. Just think about it. This is a recruitment tool. It's a
yeah,
retention tool.
yeah,
It's avoiding any type of potential litigation. It's avoiding any type of non-compliance with regulations. So yeah, I couldn't agree with you more. I mean, this is an investment in employee safety in it, but ultimately there's a return on investment for the organization as well.
yeah, yeah. I have a couple more things to just bring up, but if you have more questions, please put them right in the chat because Laura and I are still monitoring that because I don't see any other questions. We have some upcoming events for New York City home care providers on April 1st. HCP is producing a webinar giving an overview of H5N1, that's bird flu, in case you're not familiar, and other emerging infectious diseases. I don't know why I can't say those three words together. And we're going to feature experts in wildlife conservation and ag and markets, which is going to be a little bit off the beaten path from what you're used to hearing about some of these diseases. So I'm pretty excited about that. April 15th will be webinar 2 in this communication series. I will have a wonderful speaker talking about what makes a good message, how to write a message. You guys are running an agency. You don't necessarily have the education, not the education, but the training in how to put together a good message that's going to tell people what's going on, what they need to do. And that, saying the right words is as important as getting the message out there. So we're going to talk about that. And then on May 7th, we have a follow-up to the H5N1 and infectious diseases. We're going to talk about those types of things when it comes to food safety. Again, kind of off the beaten path from what you're used to hearing about mask up, mask up, mask up. It occurs to us that food is prepared in the homes by your workers all the time, and they need to know how bird flu affects that food supply, and how they can keep themselves and your patients safe from infections. So those three are coming up. We are also going to have a tabletop exercise that I hope some of you will participate in. The date for that is May 6th. I'm sorry it didn't make it onto the slides. And that will be an infectious disease. But again, I try to keep it a little out of the box from what you're used to doing. So that's a few hours of your day to knock an exercise out, which is a requirement for home care agencies to participate in exercises. Almost last but not least, my contact information. Reach out to me with any questions you didn't get to ask today. And we will include them in the follow-up information if they come before the end of the day. Please grab your phones if you're not on your phone doing the webinar itself, and grab that QR code or click on the Survey Monkey and do the evaluation. I cannot stress how important that is. What you say absolutely drives what we do. We don't want to waste anybody's time. We want to get these meetings packed, these webinars, lots of participants, because we want to give you what you need. So tell us what you need. Tell us how you liked it. Tell us what we can do better, and we will improve. And I want to say thank you to everybody. Thank you especially to Paul for taking time out of your day to do this. It's been great preparing for this, and we will figure out what we're going to do next, okay?
Thank you.
And thanks to all the participants. The recording and the slides will be sent and posted on our website. Don't look for them in 5 minutes because it does take time to download, upload all of the video and stuff like that. And then that YouTube channel that we have been building on for a couple of years has a ton of information, and this recording will be there as well. So I'm going to just leave that on the screen while everybody says goodbye. and I take great pride in not going past the top of the hour. And we're going to do our exercises while we're all just watching the screen because that's important too. All right, Mark, thanks. Feel free to pop those reactions on there before you go. That's one of my favorite Zoom tools.
Thank you, Paul. Thank you, Carol, and thanks all for attending.
My pleasure. Thank
Appreciate you
you.
popping back in, Fidel.
Thank you,
Thank
Paul.
you.
Thank you, Carol. Have a great day.
Oh,
Thank you.
Thank you.
thanks.
Thank you.
Thanks, Mark.
Wonderful. Wonderful.
Oh, I'm glad you got a lot out of it.